Hello, and welcome to Consultant Conversations, a podcast series developed by the recently appointed Consultant Committee at the Royal College of Physicians, Edinburgh. This is for the new consultants within 10 years of starting their post, and also for senior trainees so that they can benefit from this. My name is Dr. Cosmas Anazodo. I'm a member of the recently appointed Consultant Committee, and I'm a stroke consultant working at the Lancashire Teaching Hospital NHS Trust. Today, I will be discussing with my guests transitioning to the NHS as a consultant from international healthcare system. My guest is Dr. Abhijit Das, who is a consultant neurologist at Lancashire Teaching Hospital NHS Foundation Trust. He is the regional lead for the Functional Neurological Disorders Service. He's also an Honorary Associate Professor at the University of Central Lancashire. Dr. Das has more than 20 years experience in clinical neurology and research in neuroengineering. He has international experience in education and research, as well as experience of industry collaboration and entrepreneurship. He holds multiple international patents in neuroengineering, and he has published research work in peer-reviewed journals, and is the winner of multiple awards and research grants, and also has an extensive international research work. Dr. Das, you are welcome to the recently appointed Consultant Committee podcast.
Thank you, Cosmos, and thank you for your kind introduction.
Thank you so much. So, before we can go delve into the discussion, I want you to introduce yourself and your background before coming to the UK.
I think you have given a nice introduction to my background already. So my training has been done in India and also partly in US. So I've completed my MBBS, MD, and DM neurology training in India, in different parts of India. And my MBBS was from Medical College, Calcutta, which is one of the oldest medical college in the world. Then I did my medicine training, internal medicine training for MD, which is the rule in India at the PGI Chandigarh. Then I did my DM neurology training, kind of neurology registrarship from Sri Chitra Tirunal Institute at Kerala, India. Then I did my postdoctoral training in neurorehabilitation from the Crystal Foundation, Rutgers University in US. Then I came back to India. I was working as a consultant, and I was also director of the neurorehabilitation service. First was in the Institute of Neuroscience, Kolkata. Then I was working the same position, senior consultant neurologist, and also the director of the neurorehabilitation service at AMRI hospitals in Kolkata. And then I decided to come to UK, and I came here back in 2019. I initially worked as a locum consultant in stroke, and then I joined as a locum consultant in neurology in Walton Center. And since 2022, I cleared my CESR and then become a substantive consultant in neurology in the Royal Preston Hospital at the Lancashire Teaching Hospital NHS Foundation Trust. So this was quite a long journey, and thankful for the experiences that I have throughout the period.
Thank you so much. It seems you already have quite a vast experience before coming to UK. Okay, if I may ask, what made you to come to UK? What made you to change your mind to come over here?
That's a very important, interesting question. So it was not an easy decision because I was quite well settled in Calcutta and had a private practice, but I enjoyed the practice there. We had a nice group, but the main problem in India that I was facing was the work pressure, and I was not having enough academic exposure during my post, although I am having some collaboration, but just the academic research, the lack of academic research was harding because I'm a private practitioner there. So that's the main thing. So main thing that, because one of my close friends joined NHS that time, and he described the main aim was the work-life balance. And also, frankly, I'm a big supporter of the main ethos of NHS. So often I see that people in NHS do not realize the value that NHS bring not only to the patients, but to the doctors. So one of the main cause of burnout when I was in Calcutta was the incessant demand and the discussions that we were facing with the patients, discussing with them regarding the cost. Because it was a private practice, and we all know the private practice accounts 70 to 80% people in India seeing the private practice, and cost is a big issue because the patient pay out of their pocket. Often there are insurance coverage, but they're often inadequate. So, and that's a big factor. So it's difficult for a clinician when going to someone, say for thrombolizing a stroke patient, the first discussion that you had Can you afford the treatment? And those kind of discussions and the financial issues, those are draining. And there's increasing doctor-patient relationship was at a bottom during that period in India and still going on if you look at the media and other things. So it was very stressful to work as a doctor in India during that period. And adding to this, there was no much academic exposure because I was in a private practice, and that's why I decided to join the NHS, because at NHS, we have a lot of protected time. Although NHS has its own challenges, but there are few things which still makes for many people like me. NHS is one of the best places to be a doctor. It is still very much a democratic organization, and it is free at the point of care. You do not have to bother about the cost. You don't have to discuss that issue with the patients. What a great relief it is. These people who have worked throughout the NHS, they possibly will never realize what a great relief it gives to you, and the freedom that it gives to you. It's all the main factor.
Well, that's very good. I've seen some people who came from overseas, even when they were consultants over there, but they came over here and then they started as a middle grade because of the different systems for overseas to join NHS, but you came in and then started a local consultant. So how do you manage to move into the consultant level when you move from international health system to NHS? How do you manage to do this?
Yeah, so actually, I'm not the only one. There are many other consultants who often join directly as a consultant. It depends on your background and other thing, because NHS is a very structured organization. So if you have worked in the past in a very structured way, so I'll give credit to my training, because I've been trained in some of the premier institutes of India, like PGH Chandigarh and Sri Chitra. Those institutes are modeled up on some of the best institutes in the world, like Harvard and others. So our training, the way we handle the data, and our exposure to MDTs. So for the international people coming to NHS, there are few things that often stand out, like the multidisciplinary nature of NHS, that you have to take account of all your colleagues and everyone. So this was often not there in the other countries like India or the developing countries, where doctor is the only one making all the decisions. So this is somewhat different in NHS. But because I had worked in similar situation in others, so I was quite exposed to it. The other thing is the detail of documentation, which is often people who are coming from outside, the documentation is not often as detailed. And the kind of discussion with the patients, informing the patients, and the other issues, those are the huge thing in NHS, and rightly so. Those are often kind of not followed in that details in other places because of the time. You do not have any time to keep all these things because the doctors are very busy. But because I have already been trained in this, and also I have worked in the US in the past, so those exposures, and because I was exposed to HIPAA and other things, those documentation, and so those gave me the ability to come and join directly as a consultant.
Thank you so much. Is there any variable experience that made you, at least help you to settle quickly when you came into the NHS? I know you have explained about working in the US and other places and documentation, because there should be some challenges you might have faced when you join into the NHS, especially as a consultant. Great. What other experience that made you to overcome these challenges?
No, what I found that trust I joined. I initially worked in Preston, and the trust was very helpful. So when I joined, like 1 month, I shadowed another consultant and learned the ways around, and everybody has been very helpful. So one thing in NHS, and people understand it's a very structured organization, but it's a very democratic. Again, everyone is supportive. The nurses, the other occupational therapists, physiotherapists, everyone from the duty managers, they have been very supportive and structured. So because of the structure of the NHS and everything, and your rights are protected. So like, although you're a new consultant, that like the other bullying cultures and other things existent in some other areas where it is there. Fortunately, I have not faced it. So it was very smooth transition for me. And one thing a bit challenging for me, private practitioner, was that speed. It is somewhat I had to adjust, because when I joined the NHS, it was possibly and still continuing the waiting period and the other issues, the management, and that started. And I joined just before the COVID, and during the COVID, everything kind of got stopped. So that is something which I found it difficult to adjust, because I was accustomed to seeing patients quickly, treating them quickly, getting the results out in the same day, discussing with them in the same day. So that is something I found missing in the NHS. And yeah, I still miss it, but hopefully someday we'll get better.
Yeah. Will you say that your specialty, neurology and stroke, made it easy for you to move into the NHS as a consultant grade? For instance, if you come other specialty like surgery, is this something people who are coming to surgery, do they think they will be able to settle that quickly in that specialty?
I think maybe partially true, but I have seen some of my consulting colleagues, maybe some in radiology, they also, I've seen them joining directly as a consultant grade. But yeah, the main issue are you need to understand the structure of the NHS and the way NHS works. That takes a bit time. So, and the documentation, the need of documentation, the detailing of the documentation, and what to maintain, how to maintain, then working in a multidisciplinary environment, respecting everyone. And also, because people who have not worked in this kind of situations, that the detail that you need to talk to the patients and other things, these are the kind of things difference. Because in some other parts of the world, the doctors are kind of the most authority. So that has to change. When you come to NHS, you have to understand you are part of the system. You are not the only system that is available. This is something that need to change, and these are the main transitions. Otherwise, the clinics part, I think the doctors, if they're trained well and have seen enough patients, they're the same world over. But the other things, the documentation, other things, these are the critical difference in NHS. But I have seen other people coming from and joining NHS from, say, Canada and from Australia, and they have transitions very well because they're coming from the same structured system.
Yeah, thank you so much. For your biography, so that it seems you're associate professor at the University of Central Lancashire. How do you manage within the short time of being in UK to become the associate professor? So some people who might come in from overseas as a consultant and also maybe they are quite experienced in academic area, how would they go into academic also to go up the grade and also the level that you have achieved within this time?
So I'm very much thankful for the University of Central Lancashire. And that was one of the main reasons I left India. I have been, throughout my career, I have been academic oriented. I have published case reports in Lancet. I published in neurology, even from India. So when I went for the postdoctoral fellowship, I had the NIDRR grant from the government of US to the Kessler Foundation. I am fortunate to have some good mentors, so I could do some good research. So even in going back to India, although I'm private sector, I didn't plan to kind of clinical research I could not do, but I was having collaboration with a lot of engineers because I'm in rehabilitation, so I did some innovative work and the patents. So my publications continued, and I had some grants in India as well, some more of kind of industry clinical partnership grants. So I maintained it. And after coming here, I was fortunate, I got support. So I'm just very thankful to this country, although I'm a kind of new entrant, but say for now I'm in the field of functional neurological disorder. So when I moved in, I decided I just approached some of the big names just directly, like Professor Johnston, Professor Alan Carson. They just allowed me to come in and sit in their clinics. This is the most beautiful thing has happened to me. So they're kind of, so Professor Johnston, Professor Alan Carson, they're kind of my unofficial mentor. Although I'm not their direct students, but I would say I've learned from them. So when I just came here, I decided to do functional neurological disorder because of my rehab background. So I just wrote to John, so like, Professor Stone, I'm neurologist, blah, blah, blah. I want to do this, but can I come and see how it's working? I went to his clinic. He allowed me to sit in his clinic for 2 days. I also attended Alan's ward round, and I have communicated with everyone, and I'm learning from everyone. So this is another beautiful thing about this country. The structure is very much democratic. So if any international colleagues were listening to this, I would say this is a big country of opportunity. So if you are willing to do good work, you can do. And same experience I got from the Stroke Association bias. So when I joined it, there was a scientific subcommittee. I just entered my nominee. Nobody knew me, but I got elected, and it was a great boost for me. And later I worked as a chairperson of the scientific subcommittee of the bias fund. They were so helpful. They knew that I am new to this person. I do not know the structure, and they supported me like anything. It was a great experience, great learning experience. I've learned a lot. And I'm putting those experience back now because I'm developing my own service in the Royal Preston, this functional neurological disorder service. We're starting from scratch, and all my colleagues, my clinical director, Trust has been very supportive so far. So all these things that I've learned because I developed service back in India. I developed the neuroradiation service. So I know how to work with people, how to work through groups, but with the support, I'm again able to put my knowledge and my experience back to work. So this is again, I say this is the beauty of NHS, and because of the structure, it allows you to grow.
Yeah, thank you so much. That's very encouraging, especially for people who are interested to come over to UK, because some people are still having that fear that coming to NHS will quite different from their system, and that is the belief of everyone. But I still know that medicine is the same. Anywhere you read it, they are the same. The only what you need is to have the confidence and be able to adapt into the system. And as you said, you have some period of attachment, or you are following the senior people to learn a bit before you delve into the NHS at that level. So, and I know many people are still planning to come into NHS, even at that level as a consultant. Some people, due to fear, as we said, would apply for a junior post just to settle before moving up the ladder. What would be the advice to these kind of people who have this good experience as a consultant coming to UK? What do you advise them to do, and how to prepare themselves coming into UK and into the NHS?
Yeah, so what I would say now, the NHS, because of the difficult situation it's going through, I think some people feel NHS is still not the best place to work, but I would like to differ. NHS for the doctors, so what I've seen so far, is still possibly the best place to work. Yeah, there are challenges. We are facing challenges. The waiting period is going up, and we are facing all the challenges due to it. But still, as a doctor, possibly you're the most supported here. I'll give one more example to everyone and ask the difference between. So in India, I was working around 100 hours a week, and I used to handle how many calls? And I forward, so say 50 or 60 calls a day just by myself, because the patients are calling me, asking the simple questions. Here in this country, I just only get how many calls? 2 or 3 calls a day, mostly from the family, rarely from the hospital hours I'm on call. And this is because the secretaries are handling all these issues, the tiny nitty-gritty issues. And this is because of the structure of the NHS. The managers are answering the questions that the people are privileged to ask to do me. So, okay, so there's a device breaking down. What we need to do? Because I was in charge of the rehab service, I was to answer all these questions. New device coming in. Who's going to check that? Is it okay? Is it under license? I have to do it myself. Now here, I don't have to bother about this. There are people who are doing this for you. So only thing I would advise, so people they can come here as an observership. After they do the degree, maybe come as they say senior clinical fellow, work here for 6 months or 1 year, collect their, because if they're coming through like this pathway, they need to do their CSR as well. So CSR is a very good pathway for people like me to come and join here, because the moment you start working here, build up your portfolio, which is very important for CSR, build up all the data that you need to showcase the CSR. So if you are still, so I would say come here, work here. Maybe if you are not confident enough, join as a junior position, observe how things are doing, and then when you are ready, just step up. And people are always willing to support, because what I have seen, most trust, they want the people to grow into their roles. And because they know when you have people whom you know, they're growing into their roles, and they're going to stay there, because we always want colleagues. We always want, also looking for good colleagues to stay around, because we work with your colleagues. Because actually, it's a team. You need good team members.
You talk about coming to UK also because of the work-life balance. Do you think your expectation has been met since you arrived here? You think you have that time to stay with your family also?
Oh, definitely. I think my wife and my kid is seeing me more now. They are definitely happy about it. Previously, according to them, I was absent. Although I was there around, but I was coming to the home just to sleep, and again, morning away to the work. So yeah, this is definitely a thing. So I can completely agree. My personal growth, I consider my academic growth is the kind of personal growth as well. It has taken new wings after coming to this, because of the work-life balance I could achieve here. That is definitely, and that is still another big draw, I should say, for NHS.
That's very good. So would you say that you quite improved academically and clinically since coming over to NHS compared to what you were before overseas?
Yeah, definitely, yes. I think I have matured more clinically as well after coming to NHS. So if I look back, say 5 years before, I think my prescriptions are more mature now. And definitely my English has improved. If I read my letters, say 3 years back, even now, my letters are better now. The clinically and clinical decision making has definitely improved. So, because in NHS, the other thing, beauty of NHS is that it's a closed system. So you see your own prescription turning up back to you after 3 years. Then you can reflect, okay, I could have done it better. Then you reflect, okay, I could have done it better. And this is a good opportunity. And you also see, because there's other people and there are role models. So there are many colleagues, I consider them as my role model. When I see their letters, I say, oh my God, look how beautiful they have written. So can I do like it? Or look at that beautiful decision making has taken place. Also in MDT, there are beautiful case reports, the difficult cases diagnosed, identified, and you see, you participate, you learn. So another good part of NHS is that continuous learning. So you are always learning. And also you have study leaves. You can go to conferences, you can attend conferences. This was a luxury for me.
Thank you so much.
It's a very well-rounded experience for me.
That's very good. I think we'll come to the close of this short discussion on transitioning from the international healthcare system to NHS as a consultant. We had previous podcasts in the junior level who want to transit into NHS. So that will be found in the RCPE Edinburgh website. So people who are juniors can go there and listen to that and see how they can come into NHS. So thank you so much, Dr. Abhijit Das, for honoring our invitation to talk on this topic. I will hope that we can discuss with you in the future if there's opportunity to do that.
Yeah. Thank you very much.
Thank you. Bye-bye.